watching a Youth TV, empowering you.
It's the 9th of June 2022, and that day was earmarked to celebrate the people we believe are heroes or heroes. And for Mbarara University of Science and Technology, that is a very, very important day, because we believe we work alongside people that are touching lives and moving souls. Talking about that, if you're lucky that you saw this day, you need to be sure that in fact there are those that were not able to see this, not for any other reason, but because they succumbed to cardiac issues at their young age. You're talking about babies with heart complications. If there was anyone that was able to turn that around, wouldn't we refer to that person a hero or a shiro? With me today is Dr. Dora Nampija. Yes, the one you see right on your screen. Let's greet the viewer and we should be able to start from there. Doctor.
Thank you so much. And hello viewers. Happy Heroes Day. We know that everybody is a hero somewhere, somehow, because they touch lives.
Okay.
In their families, in their personal lives, and other people they meet. They are heroes, and we celebrate them every single day. But today specifically, we celebrate them and we thank God for their life.
Okay, very, very important. Now, if you're among those, congratulations, and we celebrate you today. But this particular moment is for someone who is going to look into a face of a mother, a crying mother, because perhaps that little soul is going due to any issue that it has, to do with heart issues. I do not know whether you look at their eyes and, going to console them, but all I know is that the mother is looking at you as a solution that is going to be for her child to continue living. Let's start from that situation. What do you go through? What is it like? Yes. It
is kind of difficult. For me, cardiology is a personal thing, because when I was still little, my mother had a similar situation. She was the one on the other side of the bench, a mother with a child, sick, without a diagnosis, not knowing. In Africa, we have different perceptions of heart disease. Some think it's witchcraft, some think other strange things. They think it's spiritual. And for me, now being on this side of the bench to give the solutions, I'm there to tell the mother that this is the disease. This is what we can do. There is a solution. And this is the plan. And for me, that's what drives me every single day, to be able to tell the mother, we will go through this. And there is hope. Wow.
An inspiration from a mother way long those days. Was that child you? Or?
It wasn't me. It was my brother.
Okay.
Yeah.
Wow.
So when he was sick, he's the one who follows me. So I was kind of so much in close contact. I kept thinking, why doesn't he play with me? Why is he always in hospital? Why is my mother always crying? And at that time, you can imagine, like in the whole of Uganda, there was nobody who could actually make a diagnosis to tell you early enough that your child has a heart problem, do this. Okay. Which saves time and saves a lot of pain for these parents and their children.
Wow.
So that's when I think it was a cry to God that I need to be someone who can make a difference in these mothers' lives. At least tell them what is wrong. Tell them this is the medicine we can do. Yes. And what makes it better for me is to find a child who came in all swollen, can't play, has been in hospital, different hospitals, to see them get from their bed, come and smile at you, and they come to you, they talk to you, they refer to you as one of their own. And it's very interesting that at that point in time, the child becomes mine. The parents refer to the child, Doctor Omwana Wawe. It's kind of, that is what keeps me going.
Okay. For someone watching us and hearing this for the very first time, how would you describe the condition that we're talking about? What does it go with it?
So pediatric cardiology is a very vast kind of discipline. We're talking about children who are born with heart problems, And then we have those children who acquire these heart problems once they're already born. For those who are born with these problems, we have maybe a little bit of control, which we should talk about. Have the mother attend antenatal care, have the mother feed well, folic acid to prevent those conditions that they are born with, so that a healthy mother is more likely to produce a healthy child. Then those problems that are acquired, our biggest problem here in Mbarara is a disease called rheumatic heart disease. This rheumatic heart disease is very common, and it comes from a simple sore throat. So a child gets a sore throat, it's not treated very well, and that bacteria that causes a sore throat causes damage to their heart valves. You've heard of people talking about valves are sick. So that's the rheumatic heart disease that is commonest here. There are others, but those are the major one that we deal with here every day. Yes.
And for my mother or expectant mother, are there ways those can be actually prevented?
For the congenital one, those that children are born with, I have talked about it earlier. Keep a mother healthy. We work in tandem with obstetrics. Have the mothers attend antenatal, they take folic acid, they have a healthy diet, they have their children within a reasonable age and things like that. So we advise them from the side of the obstetrician. For those that are acquired, like I said, rheumatic heart disease, we need for mothers to know that every time their child has a sore throat, they need to go to hospital and have it treated. And that alone can save many children from getting rheumatic heart disease.
Wow.
Yeah.
Let's get back to what makes you a hero. These cases finally, anyway, they are coming. You know, it's a lot of emotions here and there. In your history, do you remember a case or a child I will use saved in quotes, and you remember like you cannot forget such a case? I don't know.
Yeah, there is a child, I may not put names probably, but he's a child who has been in our care for the last like 10 years. We first saw him when he was about 5 years and came in with typical rheumatic heart disease, heart failure, body swelling, unable to play, was always admitted every month. He would be in hospital. He had dropped out of school because he couldn't be in school and he's in hospital anyway. So we kept him in care, gave him medications, and connected him to surgery. He was able to get surgery. He's one of the many people who have succeeded in getting surgery. And it amazes me that right now he's in senior 2.
Oh, wow.
He's in senior 2. He's free of symptoms. He calls me just out of the blue. He calls and says, "Doctor, you know you had holidays. I'm just calling to check on you. This is my performance." So like I'm like the second mother. When you go to school, he has to come and tell me this is what I performed like. He tells me he wants to be a doctor. He wants to be able to treat children who have been in a situation like him.
Wow.
And that for me is amazing. I call him my son.
Yes, very amazing. That was now on the case of the child. Let's go emotional now on the side of the parents, mothers and you. How do we connect emotionally?
With the mothers, we connect emotionally because we tend to see them a lot. As you know, currently, the situation in most developing countries, maybe the surgery is not very common. It's one of those miracles that we always pray for. But you keep seeing mothers and you connect, you see their pain, and you have to make sure that they understand that they are not alone in this. You're there to give them support. They have a right to call me anytime in case they are unsure. So that's how close we are, that they become family to me. That if they call in the night that there's something I don't understand, I'm supposed to be able to give them an answer, to give them a plan. So we kind of get an intricate bond where you must know, if a mother calls and says, "This is David," you must know David has this disease, this is what we've been treating, and this is how I'm supposed to talk to the mother. So they stop being mothers of patients and they become friends for whom their pain is your pain.
What actually made you to the top list of those that are going to go down in the history of the university and the hospital itself is that you're actually the only one doing what you do. like you just said, it involves a lot. Parent X is calling from Kamwenge. You must remember the name of her child. A number of them are coming, all eyes on you. Cases, I want to believe, are many. How do you balance all these? How do you do it? We could hear from you, yes.
It's a holistic approach. I have a very supportive family. They understand what I do and why I do it. Like I said, for me it's emotional. Being a cardiologist is as an emotional part for me. And how do I manage it? My family is supportive. We have a team in the hospital. We work with nurses, we work with a postgraduate student and other doctors, so that we create a team that is supportive. For where I cannot be able to do this, I have somebody I can call to take on the mantle, that this patient is coming, these are the instructions, ABC, so that the patient doesn't get lost along the way, because the moment they get lost in the system, we lose them. So they want a certain degree of continuity. So the support system I have in family, in the hospital, in the university, keeps me going.
Wow. That is to say you have a team you're mentoring in your line?
Yes. We have a team we mentor, because you don't want to say the only one. You want somebody else to come. Yes. And this becomes bigger. Yes.
Okay. We could do with a request, because this is, I think, kind of, urgent or something. From the day you were young, there was no one in the country. Today, I want to believe perhaps you're the one in the region. Could there be a call to the authorities? I don't know. I do not know whether there is a call you want to put across in making sure whatever you do perhaps is thought about.
The call is for the government to support the training of cardiologists, to support the hospitals, regional referrals, district hospitals, with the ability to diagnose, because that's also a challenge. Just imagine somebody traveling from Kamwenge, like you said. Those are so many kilometers to come to Mbarara to get a diagnosis. So government support the diagnosis, the training of other cardiologists, so that we can make this accessible.
Yes, thank you very much. We're going to end this with your heroic, kind of end. I know most of your work that you do, like you said, is more emotional. You're there, but of course there's some joy that you share.
Thank you so much for this opportunity, and I'm so thankful for the fact that I was nominated. I thank the nominating team for the small acts of mercy and kindness that keep us going every single day when life gets hard. There is a hero in every one of us out there, and on this day there are people I celebrate myself, who have been my support system. I celebrate my family, I celebrate my mom, I celebrate my husband, for they've stood by me as I made this dream come true. I celebrate the team I work with on the pediatrics ward. Those people are heroes. We work through thin and thick to make changes in the lives of children, and they're heroes to me. Everybody, go out there, be a hero, make a difference in somebody's life. Make somebody smile today, and you'll be a hero, not to be forgotten in their lives. Happy Heroes Day.
You're watching Ayit TV, empowering you.
Have you ever lost hope with a patient, seeing them around gadgets, breathless, speechless, and all you hope for is they could actually wake up again and talk to you? We're talking about critical care. In the period of COVID-19, the term ICU was common, and the only hope was with critical care specialists. Join me in welcoming Valence Niyonzima, a specialist in critical care nursing, who also made it to the list of Mbarara University of Science and Technology's Heroes list. You're welcome. Greet these people, and we should be able to start from that.
Thank you. Greetings to everybody. Like I've already mentioned, yes. I am Valence Niyonzima. I am the coordinator for critical care nursing at Mbarara University of Science and Technology.
Yes.
And I spearhead the training of students who are pursuing critical care nursing.
Okay.
Now, critical care nursing means providing care to the very sick patients, and in most cases we provide care to those whose life is supported by machines,
Okay.
those who are not able to talk, and those patients whose relatives have actually lost hope.
Oh.
For me to join this kind of training,
Yes.
I was motivated by two patients I took care of during the time when I was doing my internship, where the caretakers repeatedly requested us to allow their patients to be taken home so that they could die from there. And the team that I was working with did not allow them to take these patients back home, and eventually these patients made it. So I was motivated to pursue this kind of training, given the fact that once these patients who are very sick receive the appropriate care, they can actually make it.
Wow. Very, very important. And that exactly one is what makes him a hero and worth celebrating. Well, you handle cases and situations where the family has completely lost hope, to an extent that, please no, let's take home, he will die peacefully and don't mind about this. When it gets to emotions, how does it connect with you people in there?
So of course, as you may be aware, when you take your loved one to the hospital, you are stressed because you are not sure of the outcomes. And when you see someone whose life is under the support of machines, it gets worse. And so one of our responsibilities is to give these people hope. And we do our best to make sure that these patients receive the best care we can provide, and that eventually optimizes their outcomes. And in addition, we also provide psychological support to the family members, because most of the times these family members break down seeing their patient helpless, not able to breathe on their own. But also, some of the health workers who actually provide the care to these kinds of patients end up breaking down, because providing care to someone who cannot talk to you, who cannot tell you are doing this, so I want you to do this, is also challenging in its own. So at times, health care workers also break down, and it is again our duty to support our own brothers and sisters as we provide the care to these patients. Yes.
Okay, thank you. If we are to get into the numbers, how many are we looking at on a daily, averagely, in the ICU?
Now, thank you very much. So, critical care per se is not about numbers.
Yes.
In well-established ICUs, we are looking at one nurse providing care to one patient. And it is only when you have the right numbers of nurses that patients can receive the appropriate care and get good outcomes. So in settings where the nurse-patient ratio is not 1-to-1,
Yes.
Usually the outcomes are not good, unless you have patients who are stable. There you can go for maybe one nurse providing care for 2 or 3 patients. But for the very sick patients, it should be 1-to-1. One patient to one nurse. And
We
yes.
could look at the most common cases in the ICU.
Yes. So the most common conditions in the ICU are road traffic injuries, mainly traumatic brain injury. We have patients who come in with a stroke. We have patients who come in with spinal injuries, and also have patients who come in with complications of chronic diseases such as hypertension, diabetes, kidney disease, to mention but a few. Yes.
Okay. Looking at the ratio that you mentioned a few minutes ago, and of course, and the number of challenges that one would actually put out within the line of work, would there be a call that you would wish to put out to authorities regarding critical care?
Thank you. So, First of all, I want to appreciate the Ministry of Health because it has been providing support to students who are pursuing critical care here at Mbarara University. What I didn't mention is that Mbarara University is the only university in Uganda that is providing training in critical care nursing, and we have received a number of scholarship opportunities for our students. There are a number of challenges, of course, that we face. To begin with, is that the training sites where we take our students are not to the level where we want our students to train from, because we are training nurses who will work in Uganda and abroad, and we would want to expose them to the best facilities ever. So my first request to the government is to improve the status of ICUs in Uganda, so that we have the best facilities for training, but also the patients we provide the care to receive the best services. Secondly, is that the staffing levels are still low. As I talk now, I am the only critical care nurse who is managing the program. Of course, there are other cross-cutting courses which do not require someone with critical care, but still there is a lot of workload for one person. So I would also request the government to improve staffing levels for these upcoming specializations, so that we can provide the best training to our students.
Okay, wow. Yes. Now, we may not be wowing challenges, but he is among the only 3 critical care nurses that we have in the region, and that is why we actually celebrate him today. As we end this, we could look at the, for whatever experience that you've been through, if you remember any heroic, of course I know there are many, if you remember a situation or case that you handled and you feel proud, you feel this should actually be written under your heroic name.
Thank you. So there are quite a number of moments that I can talk about. But there is this special case who was involved in a road traffic accident. The skull, he had a fracture of the skull and the brain was out. We were able to provide care to this young lady, and eventually she came out of the ICU walking. Wow. So that is one of the many cases that we have provided care to, and I am very grateful. Of course, it's not the nurses only, it is teamwork. Usually in the ICU it is teamwork. We have nurses, doctors, and the other healthcare providers, who all work as one team in providing care to these very sick patients.
Okay, wow. On such a day, what message would you have for the public? It's Heroes Day.
Yes, the message I have for the public, and specifically to my colleagues, the nurses, is to provide the best care to these patients. You never know when someone will become critical. There are patients who come in walking, and eventually they become critical and they die. So my message to the nurses is to try their best, provide the best care they can to these patients. And I want to take this opportunity to wish everybody a happy Heroes Day.
You're watching a Youth TV, empowering you.
If you're doing something that is not so common in that community, extraordinarily effort that you are doing in your community, you deserve to be called a hero, or in any case, a hero. Now, on the same day, I'm privileged and very much honored to talk to a celebrated professor here in Mbarara. You cannot come to this region with any problem around, in our understanding, around head, I would say, head issues, and you're not going to hear the name Professor Kitia. Prof, you could say hi to the viewer and we start from there.
Hello viewers, my name is Dr. David Kitia.
Yes.
I work as a neurosurgeon in Mbarara Regional Hospital and in this community.
Okay, very, very privileged. Prof, when we ran a call from the Mbarara University of Science and Technology community, both staff, students, we're looking at names we know are going to go down in the history of the university and the history of the region anyway, as those that have diligently done their work extraordinarily. The name Professor Kitia was among those that came. Do you feel proud about that before we proceed?
Yeah, yes, I am, and yes. I would like to thank those who nominated me as a hero for this year.
Yes.
Bagamba entasima ebulajiwa. So I appreciate that gesture.
Wow, very, very important over there. Prof, for someone that is viewing us for the very first time and hearing you, for the very first time, let's start, because you said you are a neurosurgeon.
Yes.
That is more of scientific. If we are to break it down for the public, what would it go for? What would it mean?
It means a surgeon who treats patients with head problems and spine problems, back problems. Yeah.
We could pick a few and look at them.
They treat patients of brain injury. They treat patients of spinal cord injury. They treat patients of hydrocephalus, brain tumors, brain infection. They treat patients of congenital problems like hydrocephalus. Although hydrocephalus could be post-infective, like in our case, it is commonly post-infective, but it can be a congenital problem. They treat conditions of back problems, like in babies, congenital swellings in the back. Yeah.
So all the conditions our papas and mamas used to say, that one, if you get that injury, you're gone. You're talking about someone, for example, gets an accident. So we're talking about the injuries here, or the cord is broken and all that.
Yeah.
Che, quite hard for there. If one called you, or named you the Jesus of the world, you wouldn't have a problem with that?
I would have a problem, because we cannot compare ourselves to the Lord, because we work for Him. He sends us to serve His people. We treat, and then He cures.
Prof, that was to say that what you do is not for everyone. Not everyone is going to open the head and reassure whoever went there is going to come back alive. And you have done that for years. Talking about doing it for years, let's talk a few numbers that you remember in your history of your work. Could you remember a few numbers? You say, now I think I've worked on 1,000 heads. That is to ask it.
If 1,000 heads, yes, and probably more than that, since I started working on heads. But I can say, for example, how many cases we see per year.
Okay.
And I would say that the numbers keep on increasing per year. And last year we admitted over 1,500 cases of neuro cases. And the previous year we admitted over 1,100 cases of neuro cases. So they keep on increasing per year, both in the clinic and on the ward and in theaters.
Okay. We are talking about at the regional level.
No, the hospital level.
Okay.
That is hospital level.
Hospital
the cases we
level.
have admitted, the cases we have seen in outpatient, and the cases we have operated on.
Okay. Earlier today when we posted and say wait for an interview with Prof. Kitia, someone said, I hope he helps and talks about, the recent report that around 14 million Ugandans are running mad. I do not know whether that actually has any connection with your line of work.
That is under psychiatry, but some of our patients can get there, especially those who have neurotrauma, brain injuries.
Yes.
Post-traumatic psychosis is a common problem following trauma. Depression, epilepsy are common conditions which compound neurosurgical issues, especially trauma.
Prof, a few minutes ago, it was really so human of you, or humble of you, not to compare yourself to Jesus, because there are cases I know, or situations where family members of a victim can only say it's only Jesus really that is going to work here. If we are to look into your history, well, of course, I know you see some of these cases every other day, but we could pick point to remember a situation or a case that even you knew you had, I think, one chance of this patient getting out, and they got out. I don't know if there is that unique one that you could pick point. Did it come out well?
Yes, it did.
Okay.
I think the commonest patients we talk about are those who have old blood collection in the inside there. When they come in, they are low. Clinically, they are low. They are non-talking. They are very sick, and we take them to theater. There are many. We take them to theater, and a simple operation like making a hole on the head will cause a very big change in this patient. A very big change. I think those are the ones that we should talk about, and they are probably one of the commonest operations we do in this hospital, and one of the commonest operations people do in your surgical unit.
Prof, as I enter the hospital with this victim or patient or a case, for that matter, there's that probability of he's dying, he might actually get back. Whatever you go through in the room there, you're perhaps about to share with us, but it ends with breaking the news. Let's go the emotion side of it. How do you go about that?
Because we prepare them even before we go to operate them. First of all, we grade our patients, so we shall know the risks involved, and we use that to talk to the attendants what to expect. As they take consent to operate this patient, we shall review to them what are the chances of survival of this patient. So later, when we come back and talk to them, we have prepared them before the operation. They know what to expect.
They know what to expect.
Yes.
You in there, what is going through your mind? Or you're used, I don't know, does it have to do anything to connect your emotions?
But then we are like soldiers on the front line.
Yes.
Once a war has been declared, you go and fight. So the same thing with the surgeon. The war has been declared. You go and try to save this patient's life. And when he improves, of course, it's a very big relief to you. You feel very happy that you have saved this patient. And when you don't, then you know that this was not a good day for this
Okay.
patient.
On a good day, I wouldn't really want to discuss numbers of deaths, but on a good day, if we are to categorize these cases, could we really get a percentage that he's going to move off healthy again? I don't know if that's a better
I
way
would
to
say
bring
the
it out.
majority of it depends actually on the conditions you're talking about. As I told you, we grade our patients, especially those of trauma. They are graded. If you talk about severe injuries, a good number will go. If you talk of mild and moderate, a good number will survive. So that's what it is.
I like you guided before entering. You have told us the chances of this gentleman coming out or not. When you come out and the operation was a success, as you bring out the news, I want to believe as you open the door, you come out indeed as a hero. You're bringing heroic kind of news. What has been the experience within the family members and to your side? I don't know. Yes.
Yeah, there's many people, many attendants are appreciative. They are appreciative of what has been done to their relative, and some of them they come and physically thank you for what you have done. Some of them come with some little token. A chicken here, a bunch of matoke there.
I want to believe
Yeah,
because
so,
we are in this region, perhaps cows are in the question.
Yeah. So
Okay. Wow. That is what you get actually when you do heroic work, and that is why we are profiling him. He's going to go down in history of the university, the hospital, and the region. In case you're actually there and you have his testimony, don't feel bad to come around to give that testimony. Prof, the day is for those that do a lot for the community. We believe and celebrate you and happy for you for whatever you actually do. Let's end it with your final message to the public. In it, could it also feature how we could actually avoid or prevent trauma?
thank you very much.
Yes.
Many times many of these conditions we work on are preventable. I said that the commonest condition we treat in this region is neurotrauma, and trauma is preventable if we observe road safety guidelines as they were given to us by the government. We can avoid trauma, and when we avoid trauma, then we shall cut down on the number of cases we see in the hospital. Hydrocephalus, spina bifida are also preventable. The congenital neurotube problems are preventable if we take folic acid. We've been told that all mothers of childbearing age should be taking folic acid because it has been proved that this can prevent those cases being produced in our communities. And even tumors are also preventable if we discuss how they come about. They're also preventable, and so if we could pay particular attention to prevention of diseases in the community, we shall go a long way in having a healthy community. Thank you very much. So once again, I thank those who nominated me for this year. For this, it's a big thing to be appreciated by people in the community you work with. Entasi mebola jiwa. So I wish everybody a happy Heroes Day. May we see many others.
Okay.